But I believe we can now go live across to Tamil Nadu's Additional Chief Secretary and Health Secretary, Dr. Supriya Sahu, who's just come out of the meeting with doctors. Ma'am, is there any concrete, specific steps that's been taken? Because it's a daunting challenge to protect doctors in such situations across the state, across the country perhaps. What's the key outcome from today's meetings that you've had so far?
In the meeting today, it has been definitely, we have mentioned to the doctors that we are deeply committed to provide security to the doctors as well as to the paramedical staff. They are extremely important. They provide the most essential service. And in fact, about 3 months back, we have started this process of strengthening the security system in our hospitals. And we've informed the teams today that we have reviewed, we have done a joint security audit in all the government health institutions in Tamil Nadu. And the security audit has been done with the help of the police officials, health officials, and the revenue officials. And now this has been completed. The security audit has mentioned the good points and the challenges. Wherever the challenges and the deficiencies are, Government of Tamil Nadu is working on it. Yes, Veeraghav.
That's an important message that you're saying on sending out assurance to the doctors. From an administrator's point of view, ma'am, there are issues of unfilled vacancies that have been raised, short staff that's been there. You're somebody who looks at systemic issues for long-term solutions. What would be the key steps forward in that direction in terms of, a message that you would like to send to government doctors beyond just this hospital across the state?
No, you are absolutely right. I think, wherever the vacancies are that have to be filled up, there should be no compromise, and we are at it. We have already announced the dates when the recruitments, etc. would happen. We are at it so that the pressure is actually not there. We are also ensuring that, that 2 committees are constituted, permanent committees are constituted in all the health institutions. One, of course, is the Hospital Security Committee. That would be headed by the dean or by the medical officer or the superintendent of the hospital, so that they have people from various departments within the health institution to take a review, say every 15 days, and to see what is working, what is not working. We have CCTV cameras, but we also need to make sure that the CCTV cameras must work. They are connected to a nodal center and somebody is monitoring the output of the CCTV cameras. Lighting is an important part in ensuring safety and security. So wherever there is, the need to kind of provide lighting, those areas have already been identified. Also, the police outposts, that is a very important aspect of the security. We have the security audit that we have done. It has shown that these are the areas where large number of people are accessing government health facilities, and we will be kind of providing the police outpost. One last point, but a very important point, is that it's important that we issue these passes for attenders, because these generally in government institutions, large number of people access. We want to make sure that the patients are also taken care, so that the patient amenities are provided in an adequate manner. So we have started this experiment with one of the largest hospitals here in Chennai, which is RGGH, and we have started issuing attender passes. So I think some of these steps would help us in bringing systems in place.
Right. I'm afraid we're completely out of time, though there are several questions that I wish to have asked you. We're completely out of time, but thanks very much for giving us that concrete replies that's possibly come out of that meeting, and perhaps looking at the issue in the necessity is to look at it across all district and other government hospitals as well.